I will be discussing a case that highlights the clinical significance and the implications of diagnosing neurosarcoidosis versus primary CNS lymphoma. In our case presentation, we have a 30-year-old African-American male with no significant past medical history who was transferred from an outside hospital for workup of suspected primary CNS lymphoma. He presented initially to the outside hospital with intermittent symptoms of confusion, facial droop, and gait abnormality. At that time, they were concerned for a right MCA stroke. His initial workup included a lumbar puncture and EEG, both of which were unrevealing except for transverse myelitis in the cervical spine at C3. He was treated empirically with steroids, acyclovir, ceftriaxone, and vancomycin. Over the next several months, he had 2 admissions for witness seizures. During these hospitalizations, he was started on Dilantin and Keppra and had a repeat MRI that showed extensive meningeal enhancement, with resolution of the previously seen C-spine lesion. A CT chest, abdomen, and pelvis revealed hilar lymphadenopathy and lung nodules. At this point, the outside hospital physicians transferred the patient to our institution for concern of primary CNS lymphoma. Upon arrival, he underwent a pan-CT, which showed no masses or metastatic lesions, but confirmed the presence of hilar adenopathy and pulmonary nodules. The MRI brain at our facility, which is pictured here in our slide, showed leptomeningeal enhancement above and below the tentorium. Due to the patient's young age and race, along with the presence of hilar adenopathy, neurosarcoidosis was thought to be more likely than primary CNS lymphoma. Ultimately, a hilar lymph node biopsy was performed by interventional pulmonology for a definitive diagnosis, which showed non-caseating granulomas and supported a diagnosis of neurosarcoidosis. Seizures are a common neurological presentation with a vast differential diagnosis. Primary CNS lymphoma is a malignancy that typically occurs in older adults, whereas sarcoidosis is a heterogeneous disease that is often seen in young African American adults. The differential for meningeal enhancement, as seen as the MRI, includes infection, granulomatous disease, and malignancy. Neurosarcoidosis itself is a rare disease process, and it comprises only about 5 to 10% of patients with sarcoidosis. The key point here is that the treatment of neurosarcoidosis greatly differs from that of primary CNS lymphoma. Neurosarcoidosis is treated with steroids, whereas primary CNS lymphoma is treated with chemotherapy. Our patient in the case had a long hospital course involving multiple hospitalizations and was initially thought to have primary CNS lymphoma and would have been treated with chemotherapy. However, he was ultimately found to have neurosarcoidosis, which drastically changed his treatment. Thus, it is important to have a definitive diagnosis via tissue in order to pursue the appropriate treatment in these cases.